Okay, live. That was strange. It gave me a countdown. Okay, I'm going to be very professional this time. And yes, try and start a live Instagram without rambling or making mistakes. IVF Turkey has joined. Oh, Dr. Salim is there as well. Hello, Dr. Salim. Oh gosh, there's a few people joining. How lovely. I'm going to just invite in Dr. Karacan, who is a very, very, very lovely man who's done lots of Instagram lives with us today. So let me get him in. Hang on a sec, and then I'll tell you already. All I need now is a doctor. Hang on. Accept. Bear with me. Dr. Karacan.
Hello. Nice to see you again.
How are you doing?
Fine, thank you very much. How are you? How is your life going?
It's good. I've missed you.
Thank you very much. So do I. So I'm happy to be together with you, ready to answer the questions now.
Right, let's get cracking.
Okay.
So I'm determined to make this a concise 30-minute session with you.
Okay, great.
I always steal so much time.
Okay,
so,
ready.
Right, I've already had some questions in, which I'm going to ask.
Mm-hmm.
And in fact, there's a question that I must jump to in just a moment that's already come in. So this is just to encourage everyone to drop their questions in the comments, or they can send them privately as well. Right, okay. Oh, look, there's somebody with my name here, Ms. Sarah. She's got the same name. She says, what are the possibilities of getting pregnant at 43 naturally?
Okay, when we talk about the pregnancy rate, let's separate into two ways, in two parts. First of all, let's talk about pregnancy rate per cycle, and then the second part would be cumulative pregnancy rate. This is after the transfer of all available embryos, fresh and frozen. At the age of 43, I'm speaking worldwide, according to publications of United States and Europe. The pregnancy rate, live birth rate per cycle is about 7 to 8%, not more than that. If we talk about cumulative pregnancy rate, so transfer of all available embryos, it goes up to a maximum of 10%, unfortunately not more than that. If we go up to 44 years old, then this pregnancy rate per cycle drops down to 3%. So there is a dramatic drop between 43 and 44. So that's the reason we urge our patients, all women, to get pregnant before the age of 43, 44. So then ovarian reserve decreases significantly.
Okay. Ms. Sarah, as her name was, let us know if that was helpful and if there's any more questions. So basically 43, so she just should crack on.
Yeah. There are two reasons of having low pregnancy rate at the age of 43. The first one is having less number of eggs. That's a very huge effect on the pregnancy rate. And the second one, egg quality drops by age. The chromosomal structure inside the nucleus gets older and with worse quality, then in turn helps us get poor quality embryos, which has low chance of pregnancy. There are two reasons: egg quality and the egg number decrease by age.
Okay. I hate that. It's so unfair. It's so unfair.
Yeah, you're right.
Yeah.
Compared to men who can, have pregnancies until the age of 75, even 80. So, but philosophically thinking, women, maybe nature protected women from getting pregnant over the age of 45, 46, since pregnancy is a heavy burden on the health of a normal woman. So if you get pregnant at an older age, like 50, 54, 53, it would be dangerous to your health. That might be the reason nature protected women from getting pregnant at the old age.
Yeah. Okay, I'm going to move on to this question. Which weeks are you most susceptible to a chemical pregnancy, and how can you avoid it?
There is no one certain way to avoid biochemical pregnancy. Biochemical pregnancy means there is a rise that the embryo sticks to the wall of the uterus, and the pregnancy hormones, namely HCG, rises in the blood and then drops down. So biologically, if the embryo is not well enough chromosomally or genetically, mostly woman's body recognizes this abnormality and throws this embryo out. It's a kind of natural selection, and biochemical pregnancy happens just after the in a week after the pregnancy establishment of pregnancy. Maybe it's kind of, again, another protection of unhealthy children. Body selects which one to survive in the uterus, in the body.
You know, we've got, well, I've had so many messages this week from women who are in their 2-week wait.
Yeah, you're right.
It's
yeah.
It's so I've actually got a couple of questions about those that I'll come to in just a moment. But she says, Miss Sarah has another question that says, is IVF with a donor egg risky at age 44?
There is no increased risk of IVF in women's health, but of course, as age increases, gets older, woman gets older, the likelihood of having chromosomal abnormalities such as Down syndrome, the risk of Down syndrome increases significantly. But aside from that, there is no increased risk of IVF at this age.
Okay, I have private questions here. How do uterine malformations, specifically, okay, I'm terrible at pronunciations. Does this word mean anything to you? Unicorn
uterus.
I was like, unicorn, am I reading that wrong? She said, I know the risks for a pregnancy, but does it majorly affect the success of implantation?
To our knowledge, unicorn uterus does not affect implantation rate. So the pregnancy rate in this woman having a unicorn uterus, so uterus is formed from 2 corns. The unicorn means that one corn is present, the other corn is absent. Implantation rate in women with unicorn uterus is not different from women with normal uterus. However, miscarriage rate is a little higher than normal women, because as pregnancy advances, the unicorn uterus may not be able to carry the whole pregnancy. They may not get enlarged appropriately, and women may experience miscarriage. So in short, implantation rate is the same, but miscarriage rate is higher in women with a unicorn uterus. And unfortunately, there is no way to fix this problem.
Why do they call it a unicorn uterus?
Because, again, the uterus are formed from 2 different corns. In embryologic stage, 2 corns get together and unite in the middle. In this woman, 1 corn is absent, does not develop, and only 1 corn, one side is present together with 1 tube. So that's the reason it's so-called unicorn uterus.
Hence the unicorn pointy horn.
Right.
Okay.
Yeah.
Okay. It's so weird that it's such a weird thing. I think of unicorns and I think of joy and happiness and wishes coming true, and which is why I couldn't pronounce the word earlier. Anyway, okay. Here's one. I have a scar on my uterus. Will IVF work?
I mean, the location of scar makes the difference in this case. If the scar is outside the uterine cavity, that doesn't make any difference, doesn't affect pregnancy rate. But the scar, if the scar is inside the uterus, namely in the uterine cavity, it might, disturb the uterine environment, and it may decrease the pregnancy rate, implantation rate. In order to make sure where the scar is, hysteroscopy, the procedure looking into the uterus, is recommended to make sure where the scar is. So that's the most the key factor. The location of the scar. If it's inside the uterus, it needs to be taken care of.
How do you get? Because when I think of a scar, I think of, well, a scar. So how do you get? Oh, she says it's inside, actually. Yeah, she said it's inside. So how do you get rid of it?
During hysteroscopy, we have some instruments to cut the scar tissue or to remove the scar tissue. It's so-called operative hysteroscopy. So during hysteroscopic examination, if it's possible, we remove the scar tissue to increase the likelihood of implantation.
Actually, I got a question earlier that there's a woman here that's just saying, I have a very, very low pain threshold. Do you use anesthesia for techniques such as egg collection?
We always perform egg collection under mild sedation. So because I understand it's painful procedure, so we use some mild painkillers and mild anesthesia during egg collection procedure. But we don't routinely carry out anesthesia or use any medication during the embryo transfer unless women wish to be on sleep. Because embryo transfer is a very simple procedure, as you know, but all egg collection procedures are performed under mild sedation.
I remember the feeling of the sedation during my egg collection. I felt like I'd had about 4 large gin and tonics, and when I sort of came round, the nurse said to me, she said, I don't know if you'll know who this person is, but there's quite a famous chef called Gordon Ramsay. Have you heard of Gordon Ramsay?
I haven't, no.
He's quite a famous chef over here on the television, and she said, you spoke about Gordon Ramsay quite a lot during your egg collection. I have no.
It's very nice.
It was honestly, so I had a great time. Like, yeah. Okay, here we have another question. What is the percentage? Oh gosh, again, here comes my terrible pronunciation. What are the percentage of successful pregnancy after someone has had a unilateral salpingectomy?
If the question is the pregnancy rate through IVF after unilateral salpingectomy, it's no different than women with normal genital findings, with having all 2 ovaries in her body. So one salpingectomy means the removal of 1 ovary and the tube. So it means women going through IVF with only 1 ovary. Of course, if the ovary working well, the remaining ovary is working well, there is no decrease in pregnancy rate if we obtain like 7-8 eggs during the IVF procedure. But if she is a poor responder, then removal of 1 ovary affects the number of eggs, and in turn, subsequently, affects the pregnancy rate. So the ovarian reserve of the remaining part is the key factor to having pregnancy. This is the key factor to success.
Okay. There's a comment here. This is the same woman who was talking about the scar. I might connect you directly because she's just saying she wants to try IVF. I want to try IVF. So before I do IVF, I have to remove the scar. And there's some questions about cost. So I think I'll connect you. So
yeah, please. Yeah. She can ask us, and I can also explain the procedure with details if she likes to go through IVF.
Yeah, okay. There's a really, really important comment here that I need to read out. It says, he is very handsome.
Thank you very much. Thanks a lot.
I think that's going to be my favorite one there. Okay, Catherine. So Catherine says, what is a mock before embryo transfer?
Mock, that's what I heard, right? Mock. Mock transfer. We sometimes have some difficulty going through the cervical canal, and it also affects pregnancy rate by contaminating the catheter, tip of the catheter. Therefore, we on the day of egg collection, at the procedure of egg collection, we introduce a catheter into the uterus to have an easily the transfer of the catheter. So we try the cervical canal to make sure it's open, or it's quite adequate for the catheter. So it's called mock transfer. And another denominator of the mock transfer, we sometimes, before doing frozen embryo transfer, we like to prepare endometrium to make sure endometrium gets ready or gets thicker for the implantation. And we prepare endometrium by using some estradiol tablets or injections to see endometrium is doing well for the transfer. And if it doesn't develop enough, we increase the dose or adjust the dose accordingly. So these are two areas we call mock transfer. I don't know what she meant by mock transfer, but these are the explanation of mock transfers.
Yeah, it's a bit like, for us, like here, like, you know, when you go to school just before your exams, you have mock exams. They're just to see what you need to improve and stuff. And I love the idea of a mock embryo transfer. Is that done all the time, or do you have to ask for that, or is it only for certain cases?
We just do it in some cases who didn't get pregnant following conventional IVF cycle. Then we go ahead and plan mock transfer or mock preparation of endometrium to adjust the endometrial lining better. So we don't do it routinely. We just perform this in women who had previous failed attempts.
Yes. Okay. I have a question here by a woman who's, sadly, she had 3 failed implantations. She said, I heard the doctor the other night talk about sticky blood. Can you explain what this means?
It's another debatable issue in the reproductive medicine, because recently we have believed that coagulation disorders, namely sticky blood, might cause miscarriages by altering some implantation pathways. And we have used anticoagulant medications to thin the blood. Blood thinners were used to prevent miscarriages in women. But after having some recent studies, it's not been shown to be effective in all women who had miscarriages in the past. If a woman has some coagulation disorders, tendency to coagulate earlier than expected, might be using some anticoagulant medications, blood thinners, on the day of embryo transfer. So, but it shouldn't be used routinely on all patients.
Okay. All right then. Oh look, we've just had. Oh yeah, Catherine was just emphasising, yes, the mock one there, and Vicky, who's one of our lovely fertility coaches, she said she had a mock one too. Okay, right. There's a question here. Does the experience of the embryologist affect the outcome at the end?
Yeah, of course. There are some factors affecting pregnancy rate. Ovulation induction and egg collection procedure might be affected by gynecologists, honestly speaking, of course. And the lab conditions also effective in having reliable pregnancy rate. And the workers, staff in the embryology lab, mainly chief embryologist, is another effective factor in the success rate of IVF. So these are all important parameters on affecting pregnancy rate through IVF. That's the reason, before applying to an IVF center, please make a search on these staff members and the IVF labs. That's important.
Yeah, absolutely. Catherine is saying, is there a chance of twins with only one embryo transfer?
Yes, if after the embryo transfer, it may split into two. Even if we transfer one single embryo, it may split into two in the body, in the uterus, and there's a chance of having twins from one single embryo. So it's possible.
Okay. Oh, Vicky has a question here. Could you explain how elevated natural killer cells are treated? What's elevated? Like, is that really bad?
Right. High percentage of natural killer cells. It's another hot topic in reproductive medicine. Natural killer cells play important roles in the reproductive area and in the immune defense of women. However, there is no consensus about the efficacy of natural killer cells, neither on the implantation nor on the sustain the embryo or the pregnancy. So that's the reason we have almost abandoned, left the assessment of natural killer cells in the body. In the past, we assessed natural killer cells in blood. However, rate obtained in blood, or the level obtained in blood, does not reflect the environment around the uterus, around the endometrial area. That's the reason we have left the assessment of natural killer cells. And most of the centers do not perform natural killer cells assessment in the recent years. It was popular, but left now.
Yeah, I just hate the term natural killer cells. It's such a, there's so many terms that just sounds so horrid. Now you did oh, hang on, Catherine, is it safe, the thaw process for frozen embryos, and what are the rates?
Yes, it is proven to be safe for the embryos, because there are studies showing the looking into the abnormality rate following frozen embryo transfer, and they found that and we also observed that the abnormality rate following frozen embryo transfer is not different from fresh embryo transfer. So all women can go through IVF with frozen embryo transfer. Even according to some studies, pregnancy rate through frozen embryo transfer has been found higher than fresh embryo transfer due to supraphysiologic hormone levels in the fresh cycle. I'm not saying that you should go through frozen embryo transfer, but we should accept that frozen embryo transfer is a safe procedure in both terms, for women and for the embryo. So do not worry about it. This
question is just my own. How long does it take to defrost an embryo?
A few hours, only a few hours.
Yeah, but that is such a, what a crucial sort of time frame. Getting the like thawing it, getting the patient in, and then transferring. It
should be done within like 4 or 5 hours. So, because after thawing, within 2 or 3 hours, we opt to transfer the embryos. We don't want to keep them for a long time. So entire procedure, thawing and transferring, should be performed within 5 to 6 hours, maximum 5 to 6 hours.
God, you doctors and you embryologists are just incredible humans. You really are. Okay, how do you overcome some autoimmune disease without the donation process?
This is another key question, because there are many autoimmune disorders that might impact the pregnancy rate. But we usually, if there is a severe autoimmune disorder diagnosed, such as systemic lupus erythematosus or rheumatoid arthritis, we continue using conventional medications. There is no one medication to use in all patients. There is no one fits all medication. It should be treated according to the specific disease rather than one single medication.
Okay. I'm just looking at the time. We've got 5 minutes. I'm being very cautious of the time today. Is it possible that my husband can be there during the embryo transfer? Or is it just like surgery where he can't be in there, but just the doctors?
I couldn't catch the question, Sarah. So what does she ask about her husband?
Yeah, so basically when she has her embryo transfer,
okay,
can partner in the room?
Sure. We can call, we can get her husband in the room, but generally we don't like many people coming to the operating room because of contamination of the environment. So if he likes to come to the embryo transfer room, yes, he's welcome, but it takes only like 5-10 minutes. Then as soon as we get our patients into the recovery room, they'll be with their husbands in the room. So they can stay, husbands can stay in the embryo transfer room for a few minutes, not a long time.
Can you, because I remember when I had an embryo transfer, there was such beautiful music playing. It was just the most beautiful moment. Can if I come to you, can I tell you what music I want?
Yes, it's not a routine procedure, Sarah, but if you like to have some pleasant music in the room, you're more than welcome. But we don't have music in the operating in the operating theater because we need to hear ourselves. So it's important and it takes a few minutes. So we usually don't play music in the embryo transfer room.
Yeah. Okay. Is it possible to always have twins? Oh, is it possible that you always have twins when you do IVF?
It's also possible to have twins, but this is not our goal. Our aim is to get one healthy single baby because multiple pregnancies have many complications such as premature birth, hypertension, abnormality rate is also high in multiple pregnancies. However, we perform or we transfer 2 embryos above the age of 35 to increase pregnancy rate. And of course, there is a risk of twins if we transfer 2 embryos, but that's not we like to achieve through IVF. So our aim is to have one single healthy baby.
Yes. Vicky is just saying, Vicky's saying it's such a lovely thing to have our partners with us for the transfer. The IVF process is done so clinically, and so it can be such a beautiful moment to share. Yes, I totally agree.
Yeah, right.
Now, I promised, so you did an article for us recently just about the different types of IVF.
Right.
And I got some comments back from that.
Okay. Somebody
was saying here, what is the difference between mild and moderate IVF?
Our goal is to get as many good eggs as possible in conventional IVF. However, in some women have a tendency to produce many eggs, too many eggs for the after the ovulation induction. So therefore, we decrease the dose from conventional doses to lower doses to prevent ovarian hyperstimulation syndrome. And this procedure is called mild IVF, or if we use in-between doses, it's so-called moderate IVF. The purpose of using lower doses to prevent ovarian hyperstimulation syndrome, that may be a life-threatening situation after ovulation inductions, severely enlarged ovaries and the accumulation of fluid inside the abdomen, even in the chest. So therefore, we wanted to decrease this risk, and we reduced the dose from conventional units to like half of the dose we use. It's so-called mild or moderate, depending on how we use the dose.
Yeah. And I've talked to you before, haven't I, about how I had severe OHSS.
This is accepted as a complication of the IVF cycle. 10 years ago, we had many cases with OHSS, hyperstimulation syndrome, but we didn't pay attention to this syndrome too much like 10 years ago. But over the last years, there is a huge tendency to prevent this problem. So we don't like having ovarian hyperstimulation syndrome. That's the reason freeze-all cycles has been developed to get all eggs and freeze all of them if there is a risk of OHSS, and then transfer then after thawing.
You know, okay, just one more thing. So it's 3:30. What I can never really understand is with ICSI, when you put the sperm into the egg, is that not a more sort of assured way to have a successful embryo? Why bother with IVF when you can have ICSI?
Because in fact, ICSI has not been proven to be superior to conventional IVF. If there is enough number of sperm in men, then if you put egg and sperm together, it's accepted that sperm can get into the egg on its own. If there's enough number of sperm. If there's low number of sperm, ICSI is the best procedure to increase fertilization rate. So ICSI has not been shown to be superior to IVF. However, mostly in many most centers in the world, in order to prevent fertilization failure, which is 2 to 4% with conventional IVF, 2 to 4%, we opt to do ICSI rather than IVF. But I mean, IVF still can be done. Still, I can't say ICSI is superior and ICSI should be done in all cases. No, if there's a male factor, ICSI is the best solution. But if there's no male factor, sperm is all right. Conventional IVF is still acceptable solution.
Yeah. I think I always get frustrated because it was, for me, I had PCOS, my husband's sperm wasn't great. And I went through IUIs, then IVF, and then ICSI. And I remember at the end thinking, why did I go through all of that? Why didn't I just fast track to ICSI? Okay, just
we mostly do ICSI right now, just in fear of having fertilization failure. But in fact, it's no more than 2 to 4%. So I can't say ICSI is providing much better pregnancy rate. It's not proven, Sarah. So we have to be honest on that.
Okay. Okay, I'm going to ask one more question. After embryo transfer, is it better to rest and do nothing so that the baby can stay in there?
No. There is no proof of staying in bed hours after the embryo transfer. 1 hour rest, bed rest is enough. We advise our patients to get back to routine life just after the embryo transfer. There is no advantage of staying in bed 4 hours after the embryo transfer. Just you can get back to routine life.
Okay, amazing. Right, I'm going to end it there. I just need to say a couple of things because your team. Oh, actually, hang on. No, this is really important because this lovely person is saying that she got pregnant at your clinic. So thank you.
You're welcome. She's welcome.
Thank you.
I'm glad to hear that.
Brilliant and clever, handsome doctor. Gosh, okay. Can you repeat that other treatment? One is IUI, IVF, and the other was ICSI, Catherine. Yeah, it was ICSI. In fact, Catherine, what I'm going to do is I can send you the article that Dr. Karacan wrote for us.
Right.
I'll send that over. Vicky's saying, after the transfer, don't do housework.
Yeah.
Right? Got to find some excuses not to do it. Okay. Yeah, I just wanted to point out that IVF Turkey have got a patient meeting on October the 8th in Newcastle.
Right.
Are you going, or are you too?
No,
big?
unfortunately, I'm not going to be there, but my heart will be there. So I'd like to meet you again next month. Again, we can do a live stream at Instagram again next month.
Yeah, let's do it because you are wonderful. And
thank you very much.
All right then. Well, I'll see you next month, and thank you to everyone that joined.
Bye bye. I'm so glad to meet you again. See you next month. Bye bye.